One of the most common things patients say to me in the clinic is, Doctor, I used to love traveling, but now I'm too scared to leave the house, let alone the country. And I absolutely get it. When you have Crohn's or ulcerative colitis, a holiday isn't just a holiday. It's a logistic military operation, isn't it? You worry, what if I flare up in Spain? Um, what if my stoma bag leaks on the plane? How do I get my biologic injections through security? Um, but here's the truth, having IBD should not stop you from seeing the world. Hi, I'm Dr. Dean. Today I'm going to talk you through about traveling with Crohn's or colitis. I have patients who travel to remote jungles and track mountains. You just need the right plan. Um, so we are going to cover in this video about live vaccinations, the truth about stoma bags expanding on the planes, and one document you must carry to get your meds through customs. So before you even book the flight, we need to talk about your immune system. So many of you must be on immunosuppressant or biologic medications like infliximab, adalimumab, or maybe drugs like azathioprine. This means you cannot have live vaccines, and the reason being because live vaccine uses a weak version of a virus. So in a normal person it's fine, but in you it could cause a serious infection. So common live vaccines include yellow fever vaccine and typhoid vaccine taken orally, which you might need for travel purposes. So if you need these for your destination, you usually can't have them while it's on treatment. So yellow fever is one of the live vaccine. To visit some countries, you must have a proof or a certificate of yellow fever vaccination. If you can't have the yellow fever vaccine, um, your doctors can write you a medical exemption letter, which a lot of countries accept for entry. So that's one thing. About the typhoid vaccine, there is a non-live injection version you can have. So ask for that instead of the capsule, which is the live version of the vaccine. Now let's talk about getting a medication there safely. So if you're on biologics injections, there are two golden rules you must follow. So first is never put biologics in the whole luggage or never put them in the check-in luggage. The whole luggage in a plane gets incredibly cold, often below freezing temperatures. And if your biologic freezes, the protein structure breaks and the medicine becomes useless. So always take it in your hand luggage. And rule number 2 is airport security are strict on liquids of 100 mils. So you need a letter from your IBD team or a copy of your prescription that explains why you have these needles and liquids while traveling on a plane. Also consider a cooling wallet, like a cool bag, to keep them at the right temperature during the flight. And if you're not a UK resident and you're traveling to UK for a long period of time, just remember that you can usually only legally bring 3 months supply of your medication, and if you need more than that, you might need to see a doctor or get a new prescription whilst you are in the UK. So what about patients with stoma? So this is a massive anxiety for my patients with stoma. They think, or they question, will the cabin pressure makes my bag explode? The answer is it won't explode, but it might expand. So what happens as the plane climbs? Gas expands. This means your bag might fill with air, but it won't explode. So what the fix is, you should avoid fizzy drinks. So don't drink Coke or sparkling water before the flight. Um, Change bag before security. So put a fresh bag on just before you go through security. Um, and if security scanners pick up your bag, you have every right to ask for a private search. You do not have to lift your shirt in front of everyone if you're not comfortable. So know your rights. And also, I would suggest is pack your stoma supplies in your hand luggage. Um, if your suitcase goes missing in Spain, you do not want to be stuck without bags. And remember about scissors. You can't take scissors in the hand luggage. So pre-cut your bags at home before you travel and carry them. Um, so now I will talk about um, the threat of developing blood clots while traveling, and this is a serious medical advice. People with active Crohn's disease or colitis, they have high risk of developing blood clots, which is called DVT or deep vein thrombosis, compared to the general population. And sitting on a plane seat for 8 hours or so long increases that risk. So what you must do is you must move and try to walk up and down the aisle every few hours, say 2 or 3 hours. Keep yourself hydrated, drink plenty of water, try to avoid alcohol. You can buy compression flight stocks like compression stockings. And what the Civil Aviation Authority recommends is that if you had abdominal surgery, you do not fly for 10 days. So please do not risk this. Now I'll talk about food, water, and traveler's tummy. So you arrive at your hotel, you're excited, but change in food and water can trigger what we call traveler's diarrhea. Um, so for an IBD patient, this can be confusing. You might think, oh, is it a food poisoning or am I flaring? So here prevention is the key. Okay. So if you're in a country where tap water isn't safe for drinking, always use bottled water and avoid ice cubes because they are often made with tap water. Avoid raw salads washed in tap water. Stick to cooked foods. Keep with yourself what I call the emergency kit, which is the oral rehydration salts like diarrhea. If you have a high output stoma or severe diarrhea, dehydration can hit you really fast. So try to avoid that. Keep yourself hydrated. And you should have a flare pan before you leave. So before you go, ask your IBD team for a flare plan. Sometimes your IBD team can give you a standby course of steroids or antibiotics to take with you just in case if things go wrong. It acts like a safety net in your suitcase. Finally, I would say that travel is obviously stressful. Use the tools available to you. You can get a sunflower lanyard at the airport. It signals to staff that you have got a hidden disability, and also often lets you to use the fast track lane. You can also carry a can't wait card to explain you need a toilet urgently. Don't let IBD keep you grounded. With that right prep, the world is still open to you. And if you found this video helpful, please subscribe and comment below. Where is your dream destination? I'm Dr. Deenra, and stay safe and happy travels. Thank you.